what is important in our workplace, aside from, of course, equity and embracing change, it is important that we empower ourselves with good health. So for now, I want to give you learnings about gynecologic cancers like cervical and ovarian cancers. So aside from breast cancer, there are also cancers na common sa mga kababaihan. And these are the gynecological cancers. One of the gynecologic cancers that we are going to discuss today is cervical cancers. Of course, the most common is breast cancer, but we cannot really forget yung mga most common na other cancers in the women, like cervical and ovarian cancers. First is cervical cancer, or cancer of the cervix. It is the second most common cancers among women here in the Philippines. About 3,000 deaths per year is recorded by DOH. Now, what is the most common risk factor for cervical cancer? It has evidence that cervical cancer can be caused by HPV infection or human papilloma virus infection. So, itong HPV na to can be transmitted through sexual intercourse. Other risk factors include multiple sexual partners. Another would be early sexual intercourse, meaning maagang nakipagtalik yung mga kababaihan. This will be as early as 15 to 16 years old. How can we prevent cervical cancer? We can give vaccines that can stop HPV infections. And these vaccines are widely available with your pedia or your OB doctors. And we can prevent or screen cervical cancers by doing a pap smear. The pap smear can be done at 35 years old or 3 years after the first sexual contact. Once diagnosed with cervical cancer, patient can undergo surgery, radiation, or chemotherapy, depending on the stage. So it is important to screen cervical cancer so we can catch it at an early stage and we can cure it. The second most common gynecologic cancer is the ovarian cancer. It is fifth cancer among women. And the risk factor of ovarian cancer is nulliparity, or yung mga kababaihan na hindi nanganak or never nabuntis. Or yung mga kababaihan na kung nagbubuntis man ay late nang magbuntis. This is because of the too much estrogen in our body can cause both ovarian and breast cancers. We can also prevent or screen ovarian cancers by going to your obstetrician and have a pelvic examination done and a transvaginal ultrasound done. Once diagnosed with ovarian cancer, a patient can undergo surgery, chemotherapy, or radiation depending on the stage. Again, once ovarian cancer is diagnosed early, it can be curable. Now we know the facts about ovarian, cervical, and breast cancers. We want to debunk some myths na naririnig natin. Yes, pap smear actually can help screen early cervical cancer. It will not prevent cervical cancer, but it will help screen early cervical cancer. Because once cervical cancer is screened, detected early, it can be curable. So it's very important to screen early. Again, as what I've mentioned, the number one risk for cervical cancer is the infection of HPV. So if you are infected with human papilloma virus, the chances of getting cervical cancer is high compared to those who are not infected. Yes, there's a possibility that you are high risk to get breast cancer and ovarian cancer because it has been established that both breast and ovarian cancer are hereditary, meaning genetics po siya. Pwedeng mapasa from lola to the mother, to the siblings, and to you. So, lalo na kung very high ang history, yung mother, yung sister, yung lola, there's a chance na high risk for breast cancer. But it's not too late. You can screen early as 25, 30 years old, you can screen for breast cancer. Well, if you get an HPV vaccine, the chances of getting cervical cancer is low, meaning you have lower risk of getting cervical cancer. But you can still get it because, as I mentioned earlier, there are other risk factors like multiple sexual partners, early sexual intercourse. So it's still important to screen. It's still important to do the test and screening. No, because it has been established that breast cancer is caused by a mutation in our cells, and it is not caused by trauma or hindi na dahil sa bugbog or nasipa ng anak o ng baby. Hindi po yan ang cause ng breast cancer. So bakit pa yung tanong na yan about talcum powder? Kasi there are women who uses powder sa kanilang perineum, sa kanilang puwerta. So, there are conflicting studies on the link of talcum powder o yung mga baby powder with ovarian cancers. May mga studies that show that this powder may cause ovarian cancers. There are also studies that tells us that it will not cause. But as of now, the evidence points to that there is no link between powder and ovarian cancer. Well, when we say ovarian cysts, these are usually benign masses of the ovaries. So depending on your OB, you should talk to your obstetrician. If the ovarian cyst is symptomatic, then maybe there's the indication to remove it or for you to undergo surgery. If not, then the OB can just observe it. It is difficult. It's quite difficult to detect early ovarian cancers because usually they don't have symptoms. But it's not impossible. Meaning, if you go to regular screening, go to your obstetrician, and have regular screening with pelvic exam, transvaginal ultrasound, then you may detect ovarian cancer even if you are still asymptomatic or no symptoms. Well, actually, studies have shown that oral contraceptive pills have some protection actually against gynecologic cancers. Opposite pa nga yung mga studies. They say that taking OCP can somehow protect you from gynecologic cancers. This is different with breast cancer. Okay? Different naman with breast cancer. Wala pa masyadong link with breast cancer. But with gynecologic cancers, most studies show that it will not cause cervical, endometrial, or ovarian cancer, but maybe it can have a protective effect pa nga. O what is yogurt pa? Yogurt is a probiotic, di ba? It's just like yung mga yogurt drink, either yogurt drink or yogurt cream that we eat. Okay. Well, if you have a full-blown yeast infection, then maybe you need an antifungal treatment. Okay. But yes, yogurt or any probiotics can help treat or can help prevent yeast infection or fungal infection. Because since it's a probiotic, it can help balance your microbial flora in your body, so it will prevent any yeast infection. But again, if you have a full-blown infection, I believe that you should consult a doctor and have an antifungal treatment. It is important to take care of yourself, empower yourself, be healthy, because that is the most important. Before conquering everything, before going into being busy, you should take care of yourself. And one of good things to take care of yourself is to screen, go to your annual physical examination so that you are sure that you are healthy and ready to conquer the world.